Hello everyone, welcome back to the channel. Today we're going to cover one of the most important topics in pharmacology, pharmacokinetics. If you ever asked, why does this drug work fast? Why does this one last longer? Why do we change doses in kidney or liver disease? The answer is pharmacokinetics. By the end of this video, you'll understand how drugs move inside the body, how dosing decisions are made, and why pharmacokinetics is essential for safe patient care. So let's start from the basics. Pharmacokinetics means what the body does to a drug. It explains how fast a drug starts working, how strong its effect is, and how long it stays in the body. We summarize pharmacokinetics using 4 key steps, known as ADME. A. Absorption, how the drug enters the blood. D. Distribution, how the drug moves around the body. M. Metabolism, how the drug is chemically changed. E. Elimination, how the drug leaves the body. Everything we do in dosing is based on these 4 steps. The route of administration is how the drug is given. We choose the route based on speed of action, duration of effect, and whether we want local or systemic action. Enteral routes use the GI tract. The oral route is most common and convenient. Drugs are absorbed mainly in the intestine. Problems include destruction by stomach acid and first-pass metabolism in the liver. Special oral forms include enteric-coated tablets that protect the drug from stomach acid, and extended-release tablets for longer action with fewer doses. Sublingual and buccal routes involve placing medication under the tongue or in the cheek. This provides very rapid absorption and bypasses first-pass metabolism. The rectal route avoids about 50% of first-pass metabolism. It's useful in vomiting or unconscious patients, but absorption is unpredictable. Parenteral routes involve injections. Intravenous or IV delivers directly into the blood with immediate effect and 100% bioavailability. Intramuscular or IM is injected into muscle with moderate absorption. Depot injections release drug slowly. Subcutaneous or SC is injected under the skin with slow and steady absorption. Intradermal or ID goes into the skin and is used for diagnostic tests. Other routes include inhalation for very rapid absorption through lungs, intrathecal for direct delivery to the central nervous system, topical for local skin effect, and transdermal patches for long-term systemic delivery. Absorption is the movement of a drug from its site of administration into the bloodstream. There are several mechanisms of absorption. Passive diffusion is the most common mechanism. It requires no energy. Lipid-soluble, non-ionized drugs absorb best. Facilitated diffusion uses carrier proteins and requires no energy, but can become saturated. Active transport requires energy and can move drugs against a concentration gradient. Endocytosis is used for very large molecules, such as vitamin B12. Factors affecting absorption include pH and pKa, where only non-ionized drugs cross membranes easily. Blood flow matters because more flow means better absorption. Surface area is important. The intestine has much more than the stomach. Contact time affects absorption. Faster movement means less absorption. And P-glycoprotein pumps drugs out, which reduces absorption. Bioavailability is the fraction of the drug that reaches the bloodstream unchanged. IV drugs have 100% bioavailability. Oral drugs have lower bioavailability due to first-pass metabolism. We measure bioavailability using AUC, area under the curve. Bioequivalent drugs have the same absorption and peak levels. Therapeutically equivalent drugs have the same dose, route, and effect. Distribution is the movement of drug from blood into tissues. Important factors include blood flow. The brain, liver, and kidney receive drug first. The blood-brain barrier limits drug entry to the central nervous system. Protein binding is crucial. Only free drug is active. Albumin acts as a reservoir. Lipophilicity matters. Lipid-soluble drugs distribute widely. Tissue binding may prolong action or cause toxicity. Volume of distribution shows how widely a drug spreads. Low VD means the drug stays in blood. Medium VD indicates extracellular fluid. High VD means the drug is stored in tissues. A large VD usually means longer half-life and prolonged drug action. Metabolism mainly occurs in the liver and makes drugs easier to eliminate. There are 2 types of elimination kinetics. First-order kinetics means a constant fraction is eliminated. This applies to most drugs. Zero-order kinetics means a constant amount is eliminated. Examples include ethanol and phenytoin. Metabolism occurs in phases. Phase 1 involves CYP450 enzymes and makes the drug more polar. Phase D2 is conjugation, which makes the drug very water-soluble. The cytochrome P450 system is crucial. Important enzymes include CYP3A4, CYP2D6, CYP2C9, and CYP2C19. Genetic variation affects drug response. Inducers decrease drug levels. Inhibitors increase toxicity risk. Excretion is how drugs leave the body. Renal excretion involves 3 steps: glomerular filtration, tubular secretion, and tubular reabsorption. Ion trapping is important. Alkaline urine helps excrete weak acids. Acidic urine helps excrete weak bases. Other routes of excretion include bile, lungs, and breast milk. Clearance is the volume of blood cleared of drug per unit time. Half-life is the time for drug level to fall by 50%. Both clearance and half-life increase in kidney disease, liver disease, and with drug interactions. Steady state means drug in equals drug out. Key facts: it's achieved in 4 to 5 half-lives and depends on clearance, not dose. There are 2 types of doses. Maintenance dose keeps the level stable. Loading dose provides rapid effect but has higher toxicity risk. Pharmacokinetics explains how drugs move through the body. Understanding it helps you predict drug behavior, choose correct doses, prevent toxicity, and provide safer patient care. This is the foundation of clinical pharmacology, and mastering it will make everything else easier. If you found this helpful, like the video, subscribe to the channel, and let me know which topic you want next.